Hi, Maya.
Hi.
I've just been looking over the notes. I see that you just met with the doctor. Can you tell me a little bit about how the appointment went?
Well, the appointment was okay. The doctor said I'm not doing too well with my diabetes. Says that I've been putting on some weight, and he really wants to see me lose some weight. Well, the doctor, kept emphasizing about my BMI, that it's
Uh-huh.
too high, that, ideally he wants me to lose 40 pounds.
Yeah. That really is the way that medicine thinks about this. The thing that I'd like to see if we could do is maybe reframe the discussion a little bit from such an emphasis on weight or weight loss to really thinking about health. Because it's possible for you to get your blood glucose under better control without worrying about, whether you've gained 5 pounds or lost 5 pounds, or maybe even setting up some sort of perhaps unrealistic weight loss scheme.
Well, my doctor really said that, if I can start trying to lose at least 20 pounds, and that a lot of my health condition will improve. And if I can get to 40 pounds, I would be in a much better shape.
So tell me a little bit about what's your history with dieting or weight loss, and how have you had much success with that in the past?
I've tried a ton. I've tried a ton of different diets. Not much success. And it's really hard to maintain a diet.
Yeah.
It puts more stress on me
Yeah.
to, really try to watch what I'm eating, and it's hard.
Well, so that's why I'm recommending that maybe we shift away from weight loss, because you're like a lot of us, men and women, who've tried diets over and over again without much success. And the research shows that even if we have initial success at losing weight, that we tend to gain it back and more. And you also mentioned the stress that comes with that, right? With trying
Yes.
to diet, worrying about weight, and you know that the stress is also has a bad impact on your health and probably on your diabetes. And what that'll entail is probably some of the things that you've worked on in the past, but with a slightly different emphasis. So we would talk about healthier patterns of eating, but not extreme changes or extreme dieting, and talk about raising your activity levels with things that you can do naturally at low cost that fit within your life and that hopefully can give you a little bit of pleasure at the same time. But how does that sound?
That sounds really good.
Do you think it would be a relief not to have to worry about the scale or your weight, but to focus on your health?
I think so. I hope so, because it's hard. It's hard to see every time I step on the scale. I see the numbers. It doesn't motivate me. It feels like I'm failing to begin with. I haven't lost a pound in a week, so no matter how I feel. So I think this is a good route for me.
Yeah. Well, and what you're talking about to me is also a matter of health, is that when we try to diet and we don't lose weight or we gain weight or we think we're not at the right weight, we feel worse about ourselves. And that's a health issue too.
Definitely, the frustration is, yeah.
So let's work together. Let's work on diet and activity and see over time if we can get the blood glucose levels down and see if it shifts the way that you feel about yourself.
Sounds good.
Okay, thank you.